Okay, welcome everyone to today's webinar, Effective Strategies for Engaging Men and Boys to Build Agency in Sexual and Reproductive Health for Adolescent Girls. Before we get started, I wanted to just go over a couple of housekeeping items. The first is to please mute your microphone during the webinar. If you have any questions or comments, you'll see in the participant box, there's a section for questions. You can just expand that and type in your questions later. And then under the handouts section, you'll be able to download short descriptions of the projects that we're discussing today. So with that, I'm very pleased to introduce Helene Madonick, who will be offering introductory remarks. Helene leads the gender equality team at the Bill and Melinda Gates Foundation and is responsible for implementation of the foundation's strategy to achieve substantive and sustainable results in promoting gender equality and unlocking the empowerment of women and girls. She currently also serves on the board of directors of the nonprofit Bill and Melinda Gates Medical Research Institute, dedicated to combating diseases that are major causes of mortality, poverty, and inequality in low and middle income countries. From 2007 to 2019, Helene was a director on the foundation's legal team, first in Seattle serving as the lead for legal services to the Global Health Division, and later assigned to the foundation's London office, where she was responsible for legal services, the operations of all of the foundation's offices outside the US. Welcome, Helene.
Thanks, Gwen, and hello, everyone. And let me just add my thanks for joining us today. As Gwen said, Helene Madonick, Director of our Gender Equality Program at the Bill and Melinda Gates Foundation. Very excited to welcome all of you today. I know that some of you attended the virtual panel last week, as I did, so I'm not going to linger too much on background, but just briefly, we created this series to share learnings and impact from the Foundation's Women and Girls at the Center of Development Grand Challenge. That was launched in 2015 to increase the Foundation's investment in gender equality initiatives. It actually received the most submissions in the history of our Grand Challenge program, with 1,742 letters of interest from 128 countries. And I can tell you, having been at the foundation at the time, the excitement here was palpable. In the years since, we've made gender-driven work a core area of investment. We committed $80 million in 2016 to address gender data gaps in support of the United Nations Sustainable Development Goal 5 on gender equality. We launched our first ever gender equality strategy in 2018, focusing on an area we feel especially suited to make impact, which is women's economic empowerment. And we're also increasing gender integration across all of our global work at the foundation, applying a gender lens to how we define every problem and design every solution. This includes emergency situations as well. We're closely tracking how the COVID-19 pandemic is affecting women and girls in particular, as I'm sure many of you are as well. As we hear from our partners and measure results, we'll continue to evolve our methods to ensure we are truly putting gender at the center of everything we do. Today, we're proud partners of 38 innovative Women and Girls Grand Challenge recipients around the globe. And as we've grown, we've learned that sharing what works and what doesn't is key to our continued success. And it feels particularly timely now as we face the challenges presented by COVID-19 to focus on really what works for women and girls. I'd like to say a huge thanks to the International Center for Research on Women for their continued partnership on the Grand Challenge's portfolio-wide learning agenda. It's really because of them that events like this are possible. Before we turn to introducing the panel today, just want to share truly my personal admiration for all of our Grand Challenge partners. You've dared to take on one of the world's most persistent and critical problems, gender inequality, with fresh eyes, bold thinking, and courageous hearts. Thank you for all the work that you've done and continue to do to break down barriers for women and girls every day. We also know that many of you are engaged in the response to COVID-19, and we thank you for that as well. Today, Gwyn Hainsworth, Senior Program Officer for Adolescents and Youth at the Gates Foundation, will moderate a panel on strategies for building adolescent girls' agency in sexual and reproductive health. Speakers from 3 projects in Malawi, Rise Up and GENET, in South Africa, the Wits Reproductive Health Institute, and in Niger, Pathfinder and UCSD will describe the ways in which their interventions address gender norms and engage both male and female partners. Their out-of-the-box thinking, as well as their insights into the realities and challenges of implementation and measurement, I think will be especially helpful to the gender-driven organizations in attendance today. So again, my thanks for joining, and without further ado, here's Gwyn Hainsworth.
Thank you, Helene. Sorry, the slides had a slight delay. So with that, I'd like to give a little bit of background to the topic of our webinar. Given that traditional gender norms often constrain adolescent girls' ability to make and act on decisions related to their sexual and reproductive health, there's growing recognition of the importance of engaging men and boys as part of a larger approach to increase adolescent girls' agency. Men and boys play key roles in adolescent girls' lives as partners, fathers, and community gatekeepers, and can be potential allies in increasing girls' voice and choice. However, many questions still remain about how best to engage men and boys, as well as how to integrate such approaches within programs that focus on women and girls' empowerment. And as Helene mentioned, today we're really excited to hear from 3 different programs, all of which focused on increasing adolescent girls' agency related to sexual and reproductive health. While there were key differences amongst the programs in terms of geographic context, which adolescent life stage they were targeting, and to some degree, even which sexual and reproductive health outcomes they focused on, all of them implemented distinct strategies to engage men and boys as part of their overall program approach. And they've generated learning that can really help advance our field. In order to leave time at the end for discussion, we've asked each of the panelists to briefly share an overview of their program and/or research design, their approach to male engagement, and the impact of those approaches on program outcomes. We've purposely sequenced the presentations according to life stage to reinforce the point that adolescents are not monolithic and have different capacities, needs, and contexts at different life stages, and therefore really require different approaches. Our first presentation will focus on unmarried in-school adolescents, followed by a presentation on older adolescents at risk of early marriage, and then the last presentation will be on married adolescents. To allow more time for the presentations, we've included the panelists' bios on the first slide, which you can read as I briefly introduce them. Okay, so with that, I'd like to introduce Alison Kutawayo from the Wits Reproductive Health and HIV Institute, who will present on Girls Achieve Power, or GAP year, building health, social, and educational assets for empowering girls at critical time of adolescent transition. She's joined by Nicolette Naidu, also of Wits RHI, who is the co-investigator of the RCT for GAP year. Alison?
Good morning, afternoon, and evening, everyone. I'm going to present the Girls Achieve Power program, also known as GAP year. Next slide, please. GAP year is a 5-year grant, and we're currently in the 5th year. It's a cluster randomized control trial in 26 schools in 3 townships across South Africa. 13 schools received the intervention and 13 were in the control group. To address the high dropout rates between grade 9 and grade 10 and the low reporting of violence, our main research aims were to reduce school dropout and increase the reporting of violence. Our secondary aims were to increase adolescent girls and boys' asset base, create an enabling school environment, and develop an evidence base around adolescent school programming. Gap year collected research data from 2,916 adolescents at baseline when they were in grade 8, and then again at endline in grade 10. There were 4 main components to the program, which span the ecological model because we know that change doesn't happen in isolation. The after-school program was led by peer coaches over a 2-year period, where we enrolled 2,885 adolescent girls and boys. Some of the topics in the curriculum were gender norms, HIV prevention and treatment, sexual and reproductive health, as well as decision-making, to name a few. We had an adolescent linkage to care component, seeking to improve access to local healthcare facilities and support systems. We also supported the strengthening of the National School Safety Framework to create an enabling school environment. We also had parent engagement strategies through dialogues, letters, graduation events, as well as an SMS platform that had free replies. Next slide, please. So from the onset, we always planned to work with men and boys on many levels across the ecological model. The after-school intervention targeted adolescent boys between the ages of 11 to 18 who were in grade 8 for the 2-year after-school program. Male educators and principals were key gatekeepers to our implementation and were selected as teacher champions. Male coaches selected from the research community with previous experience in after-school programming were trained on the Gap Year program, mentored and supported to deliver the 2-year curriculum. Male coaches specifically led the Year 1 curriculum with boys and then co-facilitated with females in the mixed-sex Year 2 curriculum. We know that men's access to health services is important for their own health, but also an important way to reduce women's vulnerabilities. Therefore, all males across our program were actively encouraged to access local healthcare facilities. We used drop-in boxes at facilities to measure this uptake, and this encouraged male community participation, which was an unexpected kind of bonus. Adolescent boys and male educators were involved in the National School Safety Framework baseline survey and involved in action plan development, seeking to create a safer school environment. And male parents were involved in their parent engagement activities that I've mentioned previously. Next slide, please. Here I present the overall results and the impact of male engagement in our program. 1,079 boys completed research data, which is 37% of our total. 957 boys participated in the Gap Year intervention, 33% of the total, and 10% of boys completed all Gap Year sessions, completing 100%. So far, we have trial data for one site, which is complete with baseline and endline data. And here are some of our findings for our key outcomes. We saw positive school progression rates across both arms of the intervention, with 95% of participants progressing to grade 10. We saw an increase in both formal and informal reporting of violence, especially in the intervention arm. There was an increase from 6% at baseline to 13% at endline of males in the intervention arm formally reporting violence to a healthcare provider. We saw a reduction in risky sexual behaviors, evident in the reduction in the number of sexual partners, fewer age-disparate relationships, and increased condom use. Across all participants, the number who were dating someone more than 10 years older than them halved between baseline and endline. And there was a significant increase in condom use in the last 3 months in the intervention arm. Through our wellness events, bringing services to central locations and the linkage to care strategies that we adopted, we saw almost double the number having now had an HIV test compared to baseline, from 45% to 81% at endline. There was an increase in boys in the intervention arm accessing HIV testing services, and encouragingly, boys did access healthcare facilities. 22% of those who accessed the facilities were boys, which we know this is encouraging because boys are a difficult population to access healthcare services. We saw a positive reduction in harmful gender norms. This was evident through more equitable decision-making around condom use, condom negotiation, consent or coercion, and HIV stigma. At baseline, 80% of intervention boys believed a girl could suggest a condom use. This increased to 90% at endline. Again, at baseline, 20% of intervention boys thought that a boy could force themselves onto a girl if they loved them. This decreased to 12% at endline. Next slide, please. As I conclude, I want to give you an idea of what participants thought about the strategies that I've presented so far about male engagement. The quotes that you will see on the slide now give you an idea of what we found from our qualitative data collection. As you read the quotes, you'll see that this male participant on the left enjoyed interacting with the female participants over the 2 years of programming, learning more about the opposite sex in a safe environment. A female parent noticed positive behavioral changes in her son after he'd completed the gap year intervention. And a male parent appreciated how the SMS platform had opened up communication with his child about sensitive topics that previously they'd been struggling to talk about. Thank you very much for your time.
Thank you, Allison. So now we're going to hear from Chantal Hildebrand, Program Manager for Rise Up's programming in Sub-Saharan Africa, and Takonda Kaliwu from GENET on the Engage, Enabling Girls to Advance Gender Equity project in Malawi. Chantal?
Thanks, Gwen. Hello, everyone. I'm going to share a bit more about the Enabling Girls to Advance Gender Equity project with you. Next slide. Engage is a 4-year-long project aiming to reduce the prevalence of child marriage in southern Malawi by increasing girls' agency and the advocacy impacts of civil society organization leaders in 2 districts, Palombe and Cholo. Through a partnership of 5 organizations outlined in the slide, the program focused on empowering 773 girl leaders to advocate for their rights, investing in 36 local civil society organization leaders and their advocacy strategies, and building community support and awareness through SMS and radio. Through these interventions, Engage leaders reached over 6,000 additional girls between the ages of 10 and 18 years old, training them on advocacy and their rights. These girls joined the Engage leaders in gaining commitments from over 1,200 traditional and district leaders to support the creation and passage of improved district bylaws that protect the rights of over 100,000 girls. To measure the impact of the Engage project, ICRW led a mixed methods quasi-experimental evaluation design, assessing the effectiveness of the girl and CSO interventions on outcomes related to child marriage, such as social norms and attitudes concerning girls' sexual and reproductive health rights and girls' education. We collected baseline, midline, and endline data from 4 research arms, a community where only the girl intervention was implemented, another with just the CSO intervention, the third with both the girl and CSO intervention, and a control community. This design allows us to compare the effects of each intervention independently and the combined effect of these interventions against each other and against a comparison arm. Now, you may notice something missing on this slide, something important that we're all here to discuss today. There is no mention of male engagement here. Next slide, please. That's because the Engage design didn't originally include a dedicated male engagement component. We did include men and boys in some program activities, but did not intend to engage them in the same sustained way we were engaging girls. However, the Engage girl leaders reported community pushback during their activities, including verbal harassment and threats from their peers. In addition, the Engage team received feedback from key traditional and district leaders, highlighting that it is unfair that there are so many programs focusing on girls and leaving out the boys, even though the boys themselves are struggling in these communities. Responding to the situation, the Engage partners adapted our approach to include more interventions targeting men and boys. As part of our original plan, GENET hosted 14 uncle, father, and daughter chats to create a space where girl leaders can share more about their experiences with their male relatives. Seeing the impact of these discussions, 208 male champions were identified from the group and were trained as allies for girls' rights. These male champions went on to implement awareness campaigns, encouraging over 1,000 other boys and men to listen to girls and protect their rights. As part of the CSO programming, Rise Up included 17 men as part of the 36 CSO leaders trained in girl-centered advocacy. As respected men in the communities, these engaged CSO leaders took the opportunity to directly train another 1,000 male traditional and religious leaders, in and out of school boys, and male parents and guardians on gender equity and the impact of child marriage on girls and the community itself. Next slide. Since male engagement was not an original focus area in the Engage design, it was not called out as part of the evaluation. However, the Endline evaluation survey for the Engage project, which will be conducted hopefully later this year, so we anticipate more information on the impact of the Engage project, including these male engagement activities. Till then, how do we know our program design changes were successful? Well, reports from the Engage Girl leaders and the Engage implementing partners showed that their inclusion of men and boys in the program has led to less community pushback from boys and men themselves, but also other girls and parents in the community. Since culturally men are still decision makers in most communities like Cholo and Palombe, by working with them directly, we were able to reach more skeptical members of the community and make them more open to hearing Engage Girl messages without seeing them as a threat to their traditions or culture. In addition, we observed an increase in agency amongst boys and men to be advocates for girls' rights. As one male champion from Palombe said, if all men were to use their powers properly, we would have been talking about gender inequalities and violence against girls and women by now. The training in gender and male championship is an eye-opener. Despite being powerful voices in the community, men and boys couldn't see their role in improving gender equity. However, through their involvement, they reported feeling empowered to take a stand for girls in their communities. Male engagement also contributed to our success in gaining commitments from 1,200 traditional leaders to support girls' rights. The Engage project focused primarily on advocating for the reduction of child marriage in Cholo and Palombe, and we found that the male engagement helped us reach more reluctant key traditional and religious decision makers and gain their trust and commitment to uphold laws that protect girls' rights, such as enforcing the legal age of marriage, which is currently 18 in Malawi. Male engagement further contributed to the advocacy successes achieved by the Engage leaders, including the expansion and passage of the Girl Child Care Protection and Justice bylaws and implementation guidelines in Cholo district, the creation of the first rights-based initiation camp curriculum for boys and girls promoting education and accurate sexual reproductive health information, the implementation of formal integrated sexual harassment reporting system, the increased access to youth-friendly sexual reproductive health services, and the domestication of the school readmission policy, ensuring young mothers can return to school without discrimination. These bylaws, curricula, and implementation guidelines protect the rights of over 100,000 adolescent girls. So even though the Engage project did not focus on male engagement originally, it became clear that the inclusion of men and boys is crucial to achieving advocacy wins for girls' rights in Malawi. Thank you.
Thank you, Chantal. Okay. Our last set of speakers are Bram Brooks, Senior Monitoring, Evaluation, and Learning Advisor from Pathfinder International, and Jay Silverman, Director of Research for the Center on Gender Equity and Health at the University of California, San Diego. They will be presenting on the Reaching Married Adolescent project in Niger. Bram?
Great, thanks, Gwyn. Hopefully folks can hear me. So we'll present a few slides that talk about the lessons learned from the RMA project in Niger. And before we get started, I do want to give a quick shout out to Dr. Sani, Dr. Adama, Akim, and the Pathfinder Niger team who have worked hard in the field implementing this complex research project. It's been a great privilege to work with the Pathfinder Niger team, and we're thrilled to present project learnings in today's webinar. Next slide, please. So the Reaching Married Adolescent, or RMA project, is a research project that's been implemented in Niger for the last 4 years. Adolescent girls in Niger have the highest adolescent fertility rate in the world, which is driven in part by the high rates of early marriage. By the age of 18, 3 out of 4 girls have already been married, and immediately after marriage, girls face pressure to bear children, resulting in one of the highest rates of early childbearing in the world. The RMA project presented a unique opportunity to learn about which community-based interventions were most effective in promoting FP uptake and reducing intimate partner violence among adolescent girls in this setting of rural Niger. There were two main research questions that the study was trying to answer. For our first research question, we wanted to know which intervention approaches were effective in increasing use of modern contraceptive among married adolescent girls. And for our second research question, we wanted to see if the intervention approaches affected rates of intimate partner violence among married couples in this setting. So we've designed a forum study that was cluster randomized within districts. And Professor Jay Silverman from UCSD is the principal investigator of this research portfolio. The study had 3 arms with different intervention packages, which I'll review in the next slide in more detail, and a control arm with eligible villages randomly selected across each district. What's unique about the study is that we have longitudinal and dyadic data set, meaning we have data for the same married adolescent girls and their husbands over different time points, baseline, midline, and endline. Next slide, please. The RMA intervention package was based on a socio-ecological model with a combination of approaches designed to target individual, social, and structural factors. In addition, the RMA intervention package was gender synchronized, with interventions targeting both married adolescent girls and their husbands. We developed this intervention package based on our experience and evidence from other contexts. In particular, Pathfinder's Prachar project experience in India. At the individual level, there were 2 main approaches, household visits and small group discussions. And as you can see from the slide, there were separate visits made to adolescent girls and their husbands. We made the decision to separate these sessions based on guidance and input from our team and country on what was culturally and socially accepted in the community. For the household visits, we had monthly visits led by volunteer community health workers, a female CHW for the adolescent girls, and a male CHW for the husbands. Volunteer CHWs provided information and counseling on family planning and healthy timing and spacing of pregnancies during these home visits. For the small group sessions, we had slightly different content for adolescent girls and their husbands. Female CHWs led monthly small group discussions with adolescent girls on topics that addressed health and life skills, puberty, contraception, and gender violence. And at the same time, male CHWs led monthly small group sessions with husbands to encourage support for FP use and HTSP, positive health-seeking behavior, and increased coupled communication. To tie these intervention approaches back to the study design, this is how the different study arms align with the different intervention modalities. We had Arm 1, which was just implementing the household visits. We had Arm 2, which was implementing just the small group discussions. We also had Arm 3, which was implementing both household visits and small group discussions. And finally, we had Arm 4, which was the control group implementing no community-based interventions. Next slide, please. All right, this slide shares the main findings from the RMA research study. We have different intervention arms depicted by the graphic on top. So you see the household visits there, the small group discussions, and the combined intervention modalities. And running down the side, we have the different outcomes of interest. So you have high contraceptive self-efficacy, current use of modern family planning, and intimate partner violence. When we look at the first outcome, high contraceptive self-efficacy, which is the belief in one's own capacity to use modern FP, we see that all intervention modalities increase this outcome in comparison to the control arm. The highest effect was seen in the arm implementing the combined approach, which saw a 32% increase in comparison to the control arm. When looking at current use of modern FP, we see that statistically significant results were seen in the arm with the household visits and the arm with the combined approach, which resulted in an additional increase of 22% and 24% respectively compared to the control arm. It suggests that the home visits, where in-depth one-on-one discussions with volunteer CHWs may be the ideal approach when it comes to promoting use of modern FP in this setting. And finally, when we look at the last outcome, intimate partner violence, IPV was reduced by 8% in both the small group session and the combined intervention approach. This finding suggests that when tackling social and gender norm issues such as IPV, a group forum may be the ideal format to discuss and address these issues. So Based on the results of the RMA study, our findings suggest that the combined approach, implementing both household visits and small group sessions to young married adolescent girls and husbands, resulted in improvements in current use of modern FP and reductions in IPV in the setting of rural Niger. And that's it from the RMA project. Thanks.
Thank you, Bram. And a big thank you to all of the panelists for sharing how their programs approach male engagement. I see that several of you have been posting questions in the question box, so please continue to do that, as we will have time at the end for audience Q&A. But before we do that, I'd like to delve just a little bit deeper by asking each of the programs a couple of questions. And I would ask that the panelists please keep your responses brief so that we do have time for some of these great questions that I'm seeing from the audience. So the first question I had was, why do you feel that engaging men and boys was critical to achieving outcomes like girls' empowerment in your programming? And maybe if I can start by calling on TK first, and then Nicolette, and then Bram, either you or if Jay's now on the line.
Thank you so much. Yeah, thank you. It was very critical to achieving our programs because men and boys are often still decision makers in the community. And if they are not involved, they can easily block efforts. And for girls, this meant that being shouted at or being closed out of the house because the father doesn't know where they were or they don't understand what they are doing. And some communities also feel that there are so many efforts supporting girls, but little being done for their boys. So by including empowerment of men and boys in programming, it can help ensure community support for the program and help men and boys understand the importance of girl rights and access to sexual and reproductive health services. Thank you.
Thanks, TK. Nicolette?
Thanks, Gwyn. So I think, as Alison had mentioned, our approach was quite purposeful in that, we acknowledged upfront that, young girls did not exist in a vacuum. And so we needed an enabling environment in terms of reaching our key outcomes of interest, which was really around reducing school dropout, reducing violence and improving reporting around violence, increasing better behaviors around SRHR and empowerment. And if we looked at the roles in which boy engagement plays within each of this, they were quite critical in terms of for school dropout, being able to negotiate and practice safer sex, thereby reducing unwanted learner pregnancy and then consequentially, increase or resulting in dropout. In terms of violence and safety, the data in South Africa, clearly points to high rates of gender-based violence and intimate partner violence. And so boys were critical in understanding their role around preventing violence and ensuring safety of those most vulnerable in the community. We would say the same for SRHR, where uptake and awareness of SRHR services and reducing risky sexual behaviors for couples and in joint decision making around FPUs. So they were quite critical from the onset to include in our design and our implementation. Thank you.
Nicolette. Yes, thank you. Bram?
Yeah, I think I agree with what TK and Nicolette have shared. I think, there is of importance engaging men, especially in our rural setting of Niger, which is quite conservative, and that, men are the decision makers. And while we discuss topics of family planning and, IPV, it's important to engage the men because they're often kind of the key gatekeepers, and you need blessing for them to engage in the household conversations or small group sessions. So from the onset, it was important for us to find ways to engage men through the various intervention arms. Thanks.
Thank you. So my next question is for all of you. And looking back, is there anything that you would have done differently? And I realize this is quite an open-ended question, but it is purposely so. And maybe if we can start with Nicolette.
Thanks, Gwyn. Yeah, when we were sitting down to draft this, I think it's good to see that, yes, there were things we could do differently because it meant we could strengthen our program. I think off the bat for us, one of the things we learned was the name of our program. It was Girls Achieve Power. And at the onset, in terms of our community and stakeholder buy-in, I think that bias somewhat initially made stakeholders a little bit hesitant and beneficiaries to say, what's my part as a young male in the program? But with further kind of engagement around the value that we would be bringing to engaging boys on the program, that was accepted and it was cleared. I think the other thing was the context around the country. South Africa was starting to implement DREAMS. And the focus was on adolescent girls and young women and reducing their vulnerability to HIV. What was missing was data around boys. And I think essentially at that time, which was 4.5 years ago, data on boys was quite scarce. I think through this mechanism now we've been able to generate data. So initially it might have been, it really was an unintended kind of, good outcome that has resulted. I think one other one I will just point out before kind of asking the rest of the colleagues, I think, is, parent engagement and ways that we could have done this a bit better. We've tried, but we know universally it's quite difficult to engage parents. And some of the approaches that we would possibly do differently is maybe using community radio more to advocate for the programming, aligning the parent engagement with skills building because of the high unemployment rates in South Africa. This would be a draw card for their participation as well. I'll hand it over to the rest of the team.
Great, thank you, Nicolette. Those were excellent points. TK?
So I think for us, thank you so much. I think for us, as Chantel earlier said, because our engagement was not planned, what would do differently this time or next time, or what would have done differently, is to engage boys earlier in the design of the program, which would have helped us to avoid some issues in its implementation and would have given the partners time to create specific materials for male leaders. Would have had a cohort for boys because we had the cohort for girls. If we could have had a similar cohort for boys as well, their engagement would have been sustained and well planned. Would have also made sure that we created more opportunities for girl leaders and CSO leaders to be trained together in girl-led advocacy and the creation of their advocacy strategies. During the program, the girl leaders and the CSO leaders met regularly throughout the program to align their work, share successes, and troubleshoot issues. And their advocacy strategy may have minimized the challenges and more collective strategies across both groups. Would have also had more focus on perceptions of teenage pregnancy and stigma against sexual and reproductive health services as a driver of child marriage. Many people, including girls themselves, hold negative perceptions against girls using contraceptives or accessing SRH services. So being intentional with engaging the boys, producing the right material would have been very helpful to the programming. Thank you.
Thank you, TK. So we have a little over 10 minutes left. If everybody can just mute right now. We'd like to actually switch over to questions from the audience. Hopefully, if you had a specific question, you've entered it into the question box. And at this point, I'm gonna If people could please mute. I'm going to hand it over to Laura, who's been monitoring all the questions coming in. Laura?
Yes, thank you so much. We've had a lot of questions. Many of them are more specific, directed at specific project teams, and I think we can save some of those more granular questions. Perhaps the panelists will be willing to email some responses. But there are a few broader questions which I think might be interesting for our panelists to reflect on in the minutes that remain. One of which is, so if engaging men and boys is so relevant, then why are most programs for women and girls or women's equality still not engaging them? I think that's one question. And relatedly, there was sort of a question around, or a chance to speak to some of the challenges of engaging men and boys, or if you tried something, a specific strategy that didn't work, it didn't contribute to your program outcomes. You could speak to that and what you did to address that.
Great, Laura, did you want to direct that to anybody, or can I just pick someone?
Sure, I think it's open to any of the panelists to reflect on those.
Okay. Ram, do you want to maybe start? And then hopefully Nicolette and TK can join in as well.
Sure. I think, in principle, it makes sense to engage men. And by design, when we designed the RMA program, we made sure to have it, built in a robust male engagement strategy. I think part of the challenge we realized is it was difficult to engage men. In the setting of rural Niger, we realized soon that, early on project implementation, that the men weren't there. They traveled to capital cities, neighboring countries for better economic opportunities, and it was actually difficult to do a male engagement strategy when men aren't there. So we had to kind of, pivot and figure out what's the best way to engage men. And we quickly come to realize that men will be back in their respective villages during the harvest season, which meant that you had a small window of opportunity to kind of engage men on these important topics. So yeah, in principle, it makes perfect sense, but the practical operational realities can make it challenging to find effective ways to engage men.
Thanks, Bram. I'll just follow on from there because I think some of my response is somewhat similar. I think what you reflect on is that context matters. And essentially, we have, in a very traditional or conservative community, the roles of males actually play an important part. But for our cohort, the one thing that we did see was single-headed households. Majority of the households within the three kind of clusters or districts that we worked in were females who were heading these households, or even grandmother who was supporting these young participants. So essentially, I think it speaks to the point that Bram also makes, is that essentially in principle, yes, it makes sense, but to gain access to a male community is actually quite difficult. I think the other thing is data. Data really helps guide your approach. And I think what I was saying even earlier is that the strategies, not a lot has been published, but also what is the data around the involvement of males or boys in programming. So I think that really is something that is needed and will emanate from a lot of these grand challenge investments.
And to continue from there, I think is also to be mindful that we remain, the girl programs remain and are not overtaken by men, because sometimes our idea is to say men are already privileged, they already have power, so we need to support the girls and the women to bring them up to the level where the men are. But we forget that in that power, they're still ignorant of what the girls are facing. They're still part of a patriarchy system, which they themselves, though they are quite privileged, but sometimes they don't understand their privilege, they don't understand their power. So by engaging them, you actually make them more aware of their privileges. And from what we have noticed is that most of the men are very willing to support women and girls if they know the challenges that they're facing. For example, on contraceptives, they are very willing to support girls accessing SRH when they understand that their burden will be lessened, their responsibility will be lessened. They are very willing to support women and girls.
Thank you, TK. Laura, do you have another question?
Yeah. There was a few interesting questions around engaging men and boys in the context of working with very young adolescents. And I know most of these programs work with older adolescents, but we know that gender norms that play out in later adolescence and adulthood are deeply entrenched by an early age, sometimes as young as 10. So I'm curious what you all think about how we can engage men and boys to address some of these deeply entrenched gender norms at a much younger youth and child age.
I would start in girls with the Rise Up, this program, the Engage program. We found ourselves working with very young men in our daughter father chats. We organized that girls should have a chat with their fathers on the role that they play. And we found that after evaluation, the girls suggested that it would be also nice to chat with our brothers, because these are the ones we spend time with. They're the ones who get more free time while we are working, they are resting. And we were able to engage with young boys from a very young age to say, let's do a time map. What are you doing? And what time, at the same time, what is your sister doing? And the young boys were very willing and reported to say, we'll help them. Even in classwork, we'll be studying together. I'll make sure that we have both finished our work to study together. So for me, it is very important to engage boys at a young age, because they are more willing to change, and there's not a lot at stake that they can lose. They are still forming their beliefs and social norms, and they are more willing to change. Yes.
Thanks, TK. I'll just jump in for the Gap Year program. So just to note, the cohort for the Gap Year program started at about the age of 11. But what we were very early seeing through the baseline data that we started to collect in early 2017 was that you started to see vulnerabilities or exposure to violence and risky behaviors that had already happened prior to young people entering high school. So I think the data was already pointing us to the fact that interventions needed to happen with very young adolescents, even at the point before they get to secondary school. I think the approach there in South Africa is at a critical point now, in which we are rolling out the comprehensive sexuality education. This was actually started in 2015. So I think the Gap Year program was nicely aligned with that, where the comprehensive sexuality education, which touches on gender norms, it touches on SRH, on violence, etc. Starts at grade 4. And I think that this becomes an essential point of engaging with young boys at that very young age, to be able to understand their perspectives on gender versus sex, their roles in terms of prevention of violence, gender norms, and those aspects. So for us, I would say, is really aligning to the current curriculum that's there within your ministries of education.
Okay, Laura, you I know we probably maybe only have time for one last question. I'm seeing quite a few interesting ones.
Yeah, if there's one you see that you want to ask.
So I'm wondering, there was a question from Nuhu related to RMA, which I think is an important question. He's saying there's huge differences in terms of impact between the 3 arms of the study. How does men engagement within each arm help? Sorry, I'm trying to
Understand the differences.
Understand these differences. Bram, I don't know if you feel like that's something that you can help answer. And then maybe also addressing a second, somewhat unrelated question, and others can chime in as well. There was a question whether any of the programs collected costing data. So maybe if you can first answer Nuhu's question and then very quickly answer about costing.
Yeah, sure. So on the costing, we definitely have costing data that we're currently analyzing. So it's interesting to see which of those intervention modalities are cost effective depending on the outcomes of interest. But I think to the question of like actual male engagement, because RMA collected data sets both from young married adolescent women and their husbands, you can get a sense of male engagement to see particular outcomes of interest. So for example, when we looked at varying levels of male engagement in home visits, we realized that the more men are engaged in home visits, the better the outcomes are. And that pattern is similar across the various arms. So male engagement is helpful to seeing those outcomes of interest. I think the question for us is, what's the optimal exposure? So this is an intensive research pilot study where you're doing monthly visits to the household visits, the small group sessions. And we've also realized that maybe you don't need monthly visits. Maybe if you have well-coordinated focus sessions several times a year, maybe that would generate outcomes that are similar. So this is the benefit of having a rich data set, is that we'll be able to explore some of these patterns and trends. But that's a great question, Zinuhu.
And then I don't know if the other 2 programs just very want to quickly answer whether or not you have costing data related to your evaluation.
From the gap year program, we looked at a costing element, but I think for us,
Nicolette, we're having trouble hearing you. At least for me, you're going in and out. Allison, I don't know if you're still on and able to hear, and if you know the answer to the question. It seems like we may have lost Nicolette.
Hi, yes, let me just jump in. We didn't have a costing component to the program, no.
Thank you. And TK, is there any costing work being done related to Engage?
Not that I'm aware of. I don't think so.
Okay.
Maybe Chantel?
No, there wasn't a costing element as costing data as part of our evaluation. We really focused in on really around social norms and perceptions of child marriage and related issues.
Okay, great. Thank you. So with that, we only have a minute or 2 left. So I'd like to thank all of the panelists and also thank all of you for the excellent questions. As we mentioned, we'll see if we can direct some of the questions that are specific to programs to each of the panelists in case they have an opportunity to respond afterwards. There's also handouts in the handout section. I know there was a question about whether there's a handout on RMA, and we will be sharing a recording of this webinar shortly. So maybe when we share that out, this is directed to the ICRW folks, we could maybe share the links with those 2 briefs as well as a link. I know Pathfinder does have their own technical brief on RMA. So I wanted to just offer a few remarks. It's a little bit hard to conclude such a rich diversity of learnings and points, but a few things that kind of jumped out for me. One was this point around, girls don't live in a vacuum, which we all know, and they're very much, their agency is influenced by the ecosystem and the relationships around them, in which boys and men play critical roles, and therefore it really is important to engage men and boys. I think, two of the programs, purposely did that within their program design. We heard from one program that came to that realization somewhat later, but it also shared from their perspective the importance of doing that from the beginning and building it into the design. The other point that I thought was really important was, yes, we need to engage men and boys, but we also need to be cognizant that there are unequal power dynamics, and men and boys are privileged. And so, making sure that we are deploying those approaches in a way that are helping men and boys recognize their own privilege and the role they can play as allies, but also making sure that we're not tipping the scale, so to speak, too much in ways that are maybe inadvertently further privileging men and boys. We really need to pay attention to that. This point around context matters, which I think, is kind of a key thing for many programs, but in particular, we heard how different context was in terms of both which men and boys to engage and how to engage them. And then the other point that I wanted to mention that I thought was important was this point around we have a lot of data gaps for boys, and it's great to see that gap year is contributing to addressing that gap, but I think we definitely need to be looking at other investments and studies that can help close that gap. So I think with that, I'm going to just conclude due to time. Thank everybody so much for joining. And again, handouts are in the handout section, and we will be sharing a recording of this webinar shortly with the links to the various handouts and briefs on the project. So with that, thank you everybody, and have a great rest of your day.